Good morning, my YouTube viewers. It's Palestine here. I'm just here this morning because I wanted to make another video for you. And basically, there were three things that I could have made a video on. But the video that I'm going to make this morning, I'm going to talk about what an insidious disease that diabetes is. Diabetes is a very insidious disease. And you may see people saying, oh, they're diabetic, and they may look okay to you, but diabetes is a whole body disease. It affects your whole body. And people who are diabetic, they can have like liver problems and heart problems, but they're also really prone to infection, and they can't fight off infection. And so basically, I had an infection in my eye, actually in one of the hair follicles in my eye. And I looked it up on the internet, and it said, well, don't wear makeup. So I didn't wear any makeup on the weekends. So now I'm not wearing makeup on the weekends. I still wear makeup when I have to go to work. But also, in addition to that, I'm not wearing eyeliner. I'm just wearing a little eyebrow pencil, a little bit of eyeshadow, and a little bit of mascara. But other than that, I'm not wearing any makeup. I mean, I do have eyeliner at home, but most of the eyeliners that I have are brown, and my hair's not brown anymore. It's gray. So I need to use gray eyeliners. And I have like a green eyeliner and a purple eyeliner. So all of these brown eyeliners, I may as well throw them out because they're not doing me any good anymore because my hair's not brown anymore. I also suffer from yeast infections that won't go away. The only way that they will go away is that if I'm given medication for a yeast infection. And then if I'm given medication for a yeast infection, then it'll go away while I'm taking the medication. But when I stop taking the medication, the yeast infection comes right back. So I suffer from a chronic yeast infection. So that's not very nice to have a chronic yeast infection. And that is due to being diabetic, and it's not a very nice situation to be in. And yesterday, I have a friend who I get food for, and so yesterday he was talking to me about this lady that he knows who's diabetic. I'm not going to mention her name or anything about her other than the fact that she's diabetic, but she's got type 2 diabetes, but she has to take insulin. And the reason why is because her diabetes is uncontrolled, and she doesn't really do anything to try to help her diabetes. So she eats and drinks a lot, and if you eat and drink a lot, then that's not good for your diabetes. When you're diabetic, you're supposed to eat small meals. And I try my best to eat small meals. But one of the side effects of diabetes is you get hungry. And because you're hungry, you want to eat. And another problem I have is that I can't sleep if I'm hungry. So I have to eat something before I go to bed. And I also have a hernia, because I have a hernia that affects the food I can eat as well. So I have a myriad of health problems in addition to being diabetic. It's a wonder I'm still alive. I have to take blood pressure medication to keep my blood pressure down. And so if I didn't take my blood pressure medication, I could have a stroke, and that wouldn't be good. So, but the illness that aggravates me the most is the diabetes, because I can't fight infection. And this woman that I found out about who's diabetic, that doesn't really do very much for herself to control her diabetes. I don't think she even bathes, because this guy said that he went into her bathroom and she had stuff stored in the sink and the shower. And so it looked like the sink, it looked like the bathtub and the shower hadn't even been used. So it looks like she doesn't even take a bath, you know, which that's not helping the diabetes, because when you have diabetes, your body can't fight infection. You're very prone to infection. And then one of the things he said was she had sores all over her arms and legs, and they smelled because she has the bandages replaced twice a week. But yesterday he told me that he found out that this smell actually comes from the wound, the cut, the incision from a cesarean section that never healed. And she had that cesarean section about 20 years ago. Okay, so that's terrible, to have the wound from a cesarean section that never healed, and have to have the dressings changed twice a week. But as I said, she's not doing anything to help herself. She could go on a diet. I know you look at me and you think, oh, well, you should be on a diet too. But I do try. I try very hard. I try very hard to keep my weight under control. And even now, like when I fix dinner, I try not to have a big dinner. And anything that's left over from dinner, my boyfriend has for breakfast the next morning. So I'm not being hypocritical. I am trying very hard to get my weight down, to get my weight under control. And but it must be terrible to have a cesarean section and the wound never heals, and people have to go change the dressings twice a week. That must be just awful. And that's one of the reasons why I've stopped having implants and things, because I had one implant that was a failed implant. And I thought, well, my diabetes is so bad, I can't have these, because you have to pay for it, I can't have these implants being failed implants. So I'm not having implants anymore. And then maybe when my diabetes is under control, maybe I can try to get another implant. So I'm not in a good situation. And that woman that I found out about with this wound from the cesarean section 20 years ago, she's not in a good situation. But she eats a lot of food and she drinks, and she's really overweight, more overweight than me. And I don't think she bathes, so that doesn't help. And again, like my grandmother, she was diabetic. And again, I mentioned it in a previous video, that she had a wound that never healed in her calf of her leg. And eventually, it caused her so much pain that she agreed to have the leg amputated. And then when she agreed to have the leg amputated, she said that she wished she had her leg back. So that's another problem with diabetics, because they can end up having their legs amputated if they can't keep their diabetes under control. So diabetes is nothing to laugh about, nothing to joke about. And my mom is borderline diabetic, but she's not predisposed to being diabetic. She just eats too much. And because she eats too much, she's diabetic, because she's borderline diabetic because she eats too much. But she also has a kidney infection that won't clear. And if she would try to lose weight, then maybe this kidney infection would clear up. And that's another problem, because diabetics quite often are overweight, because one of the symptoms of diabetes is that you're hungry. So you're hungry because you eat, and that makes the diabetes worse. But it makes you really prone to infections. So I've talked about, in this video, I've talked about me, this woman who I've heard of, that I've never met her, my grandmother and my mother, who were all diabetic, and the main problem with diabetes is infection. Your body can't fight infections, so you get lots of infections. And so it's a really bad situation to be in if you're diabetic. But I'm going to keep trying. I'm going to keep trying to keep my weight down. And hopefully, if I get my weight down, then hopefully my infections will clear. And then when my infections clear, maybe I can get some more implants. Who knows? Well, I think I've talked enough about on this video, and I've talked about just diabetes, which is a really serious illness. And I check my blood every day, and my blood is worse than people who are a lot heavier than me. I know another person who's diabetic, and she's not a big lady. She's no more than 5'3", but she's really seriously apple-shaped because she eats a lot. And her blood sugar is 6. She's on 2 diabetic medications, and her blood sugar is 6. Well, I'm on 3 diabetic medications, and this morning my blood sugar was 7.3, and the reason why is because last night I made a potato curry, but I didn't make a lot. I didn't make a lot of potato curry, and I didn't eat a lot of potato curry, but just having potatoes caused my blood sugar to be higher than it should be. So I think I've talked enough about diabetes. I think you've got the general idea, except for the fact that now this current Labor government wants to make people who are sick go to work. So these people who are sick who have to go to work, that's going to include diabetics. So just watch this space. We're not in a good situation, people with diabetes. So thank you very much for watching my video. If you like my video, please like and subscribe, and I will be making another video for you in the morning.